Good afternoon. My name is Elizabeth Buller, and I'm the President and CEO of Scarborough Health Network. Premier Ford, Minister Elliott, and Minister Bethlenfalvy, welcome to Scarborough Health Network's Centenary Hospital. We are so pleased to host you today for this very important announcement. I would like to thank you and your government for your ongoing support and commitment to improving healthcare and health outcomes in Scarborough. Working together, we have been and will continue to support the people of Scarborough. COVID-19 has shown us that not all communities are impacted the same during a health crisis. Scarborough is one of those communities that was disproportionately impacted more so than other regions and neighbourhoods due to a number of social determinants of health that have defined our community for decades. Throughout the pandemic, we have been out in our community expanding our reach to support long-term care homes, schools, seniors residents, and local businesses. Your announcement today and the supports we have received from the Government of Ontario have been vital in helping us provide exceptional care to our Scarborough community and residents. Premier, thank you again for being here today and for your commitment to deliver real results for the people of Scarborough. I'd now like to invite Premier Ford to the podium.
Well, good afternoon, and thank you so much, Elizabeth, for that introduction. Folks, we recently marked the one-year anniversary since the start of this pandemic. And in that year, we've seen pressure put on our hospitals like never before. They've been at the center of this crisis since day one. Our frontline healthcare heroes have been caring for our sick and vulnerable with unwavering determination and compassion. To the doctors, nurses, and staff here at Scarborough Health Network and every other hospital across the province, I want to say thank you. You've made us all so proud. I want to reassure our hospitals that we will continue to have your backs during this extraordinary times. That is why we're announcing today over $1.2 billion in funding to help hospitals manage the financial pressures created by COVID-19. This funding will help hospitals strengthen their financial position and recover lost revenue due to the pandemic, so they can continue the incredible work they're doing now and once we've beaten this virus. Focus on our next challenge, which is tackling the growing surgical backlog. I want to thank my Scarborough MPPs, Christina Midas, Minister Raymond Cho, Aris Babikian, and Vijay Tenagasalam, for advocating for the communities and local hospitals. And I'll tell you folks, you have Ford champions here in Scarborough that are advocating constantly, no matter if it's transit or hospitals. Our provincial vaccine delivery plan is how we will come out on the other side of this pandemic and return to normal, because more people vaccinated means less COVID-19 cases needing hospital care. And we're making tremendous progress. We have mobilized our pharmacies, primary care settings, mass immunization sites, mobile clinics, and of course, our hospitals. Everyone on Team Ontario has been doing their part, and the numbers speak for themselves. As of March the 21st, more than 1.5 million doses have been administered. And we have fully vaccinated more than 299,000 people, and that just means we have double doses into almost 300,000 people, leading the country. And we're expanding appointments through our online booking system. Individuals aged 75 plus, effective today, ahead of schedule. This could not have been accomplished without the dedication and hard work of an army of frontline healthcare heroes. We're so grateful to them for the vital role they've been playing in the fight against this virus. But we must do more. Ontario's capacity to deliver vaccines continues to increase, and the reality is we don't have anywhere near enough doses. We need the federal government to ensure we get a steady and reliable supply of vaccines, so we can continue to maximize the numbers of needles and arms every single day. By working together, we will beat this virus. Thank you, and God bless the people of Ontario. Now I'll hand it over to the Minister of Health.
Thank you, Premier. Since the start of the pandemic, our hospitals have been on the front line of Ontario's pandemic response. Every day, our doctors, nurses, and staff face this deadly virus head-on, and we are so thankful for their heroic efforts to protect the health and well-being of Ontarians. Your efforts have been and continue to be extraordinary. That's why our government is using every tool at our disposal to support our hospitals and our frontline healthcare workers as they continue to respond to COVID-19. The Ontario government is providing over $1.2 billion in additional funding for Ontario's public hospitals to help them further address the financial pressures created and exacerbated by COVID-19. This includes $696.6 million in funding to help cover historic working fund deficits for eligible public hospitals to ensure that they remain financially stable during this critical time. Our focus for this funding will be on small and medium hospitals, as well as specialty and rehabilitation hospitals that are facing significant strains due to their unique situations and the patient population they serve. We also recognize that throughout the pandemic, all hospitals have been challenged by the loss of other forms of revenue, such as parking, co-payments for private rooms, and the reduction of retail services, all of which contribute to patient care and support clinical services. That is why we're investing up to $572.3 million to reimburse hospitals for a portion of these losses. Ontario's hospitals have faced extraordinary challenges, and our hospital workers have worked tirelessly to deliver exceptional care for patients and families across the province. Our work with Ontario's hospitals does not stop today, and we continue to work collaboratively to ensure patients can continue to rely on the high-quality care our hospitals provide. In the meantime, I want to emphasize that all Ontarians need to continue to follow public health measures to protect our frontline healthcare workers, preserve hospital capacity, keep our loved ones safe, and stop the spread of COVID-19. By following these measures, you can make a difference and help support our hospitals. Thank you. And now I would like to pass it over to our Finance Minister and Treasury Board President, Peter Bethlenfalvy.
Well, thank you, Minister Elliott. It's been almost a year since Premier Ford made a clear, non-negotiable promise to the people of Ontario. Your government will do whatever it takes to protect you from this pandemic. Our frontline heroes have sacrificed so much over the past year, and our government will continue to help keep them safe and support them in delivering the high quality of care that the people of Ontario need and deserve. Making sure our hospitals and the healthcare system have the capacity they need to care for people during COVID-19 and beyond is part of that. Y compris s'assurer que les hôpitaux ont les travailleuses et travailleurs ainsi que l'espace dont ils ont besoin pour protéger la santé de la population pendant la pandémie de COVID-19 et après. To continue to protect people's health, it is vital that we ensure hospitals remain on stable financial footing at this critical time. This $1.2 billion investment will help relieve that burden by further supporting hospitals impacted by COVID-19. Today's funding builds on our record investments over the last year, including purchasing additional supplies and equipment for hospitals for COVID-19 testing, and critical investments to buy more PPE and supplies. This Wednesday, I will deliver Ontario's 2021 budget. Our government's second pandemic budget will focus on protecting people's health and supporting people and job creators who are continuing to struggle during these tough times. We have been fighting COVID-19 for a year now. Our budget will finish the job we started last year. And as I always say, you cannot have a healthy economy without healthy people. Supporting the financial stability of hospitals across the province isn't just necessary for our health, it is essential for our economic recovery. That's why, in the 2021 budget, we will continue to invest in Ontario's healthcare and long-term care systems for our urgent fight against COVID-19 and to strengthen it for future generations. Ontario will continue to make investments to ensure a strong healthcare system that is there for patients when they need it. And I encourage our federal partners to come to the table with their fair share as well through the Canadian Health Transfer. While we are not yet out of the woods, hope is on the horizon. Thank you to the doctors, the nurses, the personal support workers, staff, and healthcare workers across the province for protecting our health. And thank you to everyone for doing your part to keep each other safe. I want to pass it back to the Premier for any questions. Thank you.
We'll go to the phone line for questions. First question, please.
Your first question comes from Shalima Maharaj with Global News. Please go ahead.
Hi, Shalima.
Hi there, Premier.
Hi.
My question is about the pharmacy pilot involving the COVID-19 vaccinations. It currently includes Toronto, Kingston, and Windsor-Essex, but there are some areas being underserved right now, including Northwest Toronto. Peel isn't on that list just yet. Can we expect the pilot to be expanded anytime soon? And if so, when and where?
Well, good question, Shalima, and thank you for that. We're going to double the amount of pharmacies up to 700. We have 350. Really want to focus on the Peel region, York and Toronto, and I've used this example all the time. Yes, we have bushfires all around the province, and we need to address those, but we have an inferno happening in other regions, be it Toronto, Peel, and York to a certain degree. So we're going to make sure we focus on those regions, and it goes back to one thing. You know, we're at a fraction of our capacity. We need more vaccines. We should be having 3,200 pharmacies. We aren't even at 25%, take up on the pharmacies yet. But as soon as we get more vaccines, we'll be able to ramp it up even more.
Follow up?
Obviously, right now with the ramp up to 700 pharmacies, that's good news. But we've been talking to a number of pharmacies, including Shoppers Drug Mart, and they tell us that the majority of their pharmacies no longer have any doses left.
Yeah.
So when can they expect to get their new shipments to even make this rollout, the continued rollout, possible?
Yeah, that's the disappointing thing when we don't have a guaranteed supply chain, and supply chain is the critical word here. And you aren't too sure. This week we thought we were getting excess of over 300,000 Modernas. That's been cut in 1/3, so we're only getting 90,000. We don't know when we're getting the AstraZeneca. It makes things very, very challenging. There's no one who wants to ramp up these pharmacies more than I do, and I understand their frustration. You know, we've been moving forward with the supply chain and trying to keep at least 1 or 2 or 3 days in stock. And you see what happens with was my friend out in Saskatchewan, Premier Mo. You know, nothing's worse than you ramp up. You got to take it all down, as we saw in the city of Toronto back in January, February, and restart it up again. And then on top of that, you got to call tens of thousands of people to say, sorry, we're changing our appointment. So we need vaccines. That's what it comes down to.
Next question.
Your next question comes from Julianne Lemerex with Radio Canada. Please go ahead.
Hi, Julianne.
Good afternoon, everybody. My question is for Minister Bethlenfalvy.
Yeah.
Et Monsieur le ministre, j'aimerais vous entendre en français sur le budget de mercredi. À quoi peut-on s'attendre pour favoriser la création d'emplois en Ontario? Est-ce qu'on peut s'occuper de ça maintenant ou il faut attendre la fin ou la levée des restrictions? Jusqu'à quel point vous êtes inquiet sur le haut taux de chômage en Ontario?
Oh, merci pour cette question, Julienne. J'aimerais dire, premièrement, que la tâche numéro 1 pour notre gouvernement est protéger la santé et les emplois de tous des Ontariens. Et la tâche n'est pas encore terminée. Nous avons un plan pour distribuer le vaccin contre la COVID-19 à tout le monde qu'ils veulent et on va faire ça. Alors, en fait, restez à l'écoute jusqu'à mercredi, mais enfin, on doit finir la tâche numéro 1, comme j'ai dit, c'est de protéger toute la santé et les emplois de tous Ontariens.
Merci.
Follow-up?
Merci beaucoup. My next question is for Minister Elliott. Minister, last week, Christian Dubé, the Quebec Minister of Health, got his AstraZeneca vaccine in front of the camera to try to convince people to get their shot. Are you planning to get your vaccine soon, and will you do it in front of the cameras?
Well, it's unfortunate there still is a lot of vaccine hesitancy around AstraZeneca. It is safe, it works, it prevents hospitalizations, and it saves people's lives. And so, yes, I actually am planning to have to receive the AstraZeneca vaccine, and I will do it in front of a camera. If I can convince one other person to receive the AstraZeneca vaccine, and that helps protect them and their health and safety and that of their families, I'm more than happy to do that.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hi, Colin.
Hi, good afternoon, all. My question is to the Premier. Premier, the restrictions in Peel and Toronto seem to have created an underground barber and hairstyling economy. There's a lot of fly-by-night barbers cutting hair in their own homes or charging people to travel to their homes for a cut. Obviously, you know, there are questions about contact tracing and healthcare protocols in these types of situations. Wouldn't it make more sense to reopen salons in Toronto and Peel to give people a safe place to cut their hair so they don't have to resort to this underground economy?
Yeah, no, you know something, Colin, before I pass over to the Minister of Health, I hear you. I hear the same thing. Look at me, you know, I'd go to the dog clippers right now and pull up and get my hair clipped because literally in the morning it looks like that. So I got more gel on here than you can shake a stick at. So once we get that open, I'll be first in line. But we got to be cautious always in the healthcare and area on the health side, I should say, in Toronto and Peel. And I just want to make sure everyone's vigilant. And yes, we have the toughest restrictions anywhere in North America right now, but we do have to be cautious. I'm going to listen to the direction of Dr. Williams and the health team, and I'll pass it over to the minister. Thank you.
Well, it's unfortunate that we have these underground operations going on because we're nearly there. This is a race against the clock to vaccinate as many people as possible and to prevent the variants of concern from growing exponentially. So what we're asking people to do is please be a bit more patient. Please continue to follow the public health measures. Personal services like hair salons are more dangerous because people are in closer contact, and that reduces the risk, increases the risk of transmission. We want to make sure that we reduce that risk, and so we are asking people to please be patient. Another few weeks, you will be able to get your hair cut, and I've been waiting for that for a long time myself, but this is something that's so important for everyone's health and safety, and we want to make sure that hopefully within the near future we will be able to move both Toronto and Peel into a lower level, perhaps into red, but it all depends on everyone to continue please following those public health measures. They're just so important in reducing transmission.
Follow-up?
Thank you. Back to you, Premier. Over the weekend, I think we saw a lot of people, you know, sunshine on patios in Toronto and Peel. So your government is expanding indoor and outdoor dining, yet restaurant workers who have to encounter hundreds of unmasked diners every single week, they aren't being prioritized for the COVID-19 vaccine right now. I'm wondering, should they be moved up the list, seeing as they will be seeing more and more people as the weather turns nicer?
Yeah, I understand the situation they're in, but you know something, we got to be super cautious. But for mental health, I'll tell you, we needed that. People needed to get outside and get some fresh air and be super cautious. But in answering your question, Colin, we're going to continue focusing on the most vulnerable. Most vulnerable was 80 plus. We ended up getting 50% of 80 plus done. We moved it to 75. And I want to be clear to everyone, just until they understand, because I had a call on the weekend. Someone was a little confused. So 75 plus can book through a mass vaccination center. 60 upwards to any age can go to the pharmacies. So that's what we're going to continue focusing on. And then once we, you know, as I said on Friday, once we get the vaccines, we're geared up. We give us 4 or 5 days, we'd be geared up to 9 million vaccines, and we wouldn't have to worry about that. We'd pretty well clean up the vast majority, not all, but the vast majority of the people, at least with their first first shot.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. We've noticed that on the weekend again, the vaccine numbers were quite low, about 31,000, half of what they were on Friday. What can you do to get those vaccination numbers up on the weekend? Are people not booking appointments for the weekend? It seems like every delay is a problem, and we keep having this, as we had with low testing on weekends a year ago.
Yeah, I'll just go to root cause. It's the vaccines and understanding the supply chain. The last thing they want to do is ramp it up, and when they literally, some of them have 1, 2, maybe 3 days of supply, and then all of a sudden it disturbs the supply chain, and they end up calling back tens of thousands of people because they've run out of vaccines. That would be just terrible if that ever happened. So we're making sure the process flow continues, that we keep these vaccination centers open, and that's really the reason they did about 31,000 on Sunday. We're back up at it. We hear good news that we're going to get some Pfizer today, which is great. We're going to get another 90,000 Modernas, which is great. But again, once we see consistency in the vaccination centers, I hear it all over the province, they don't have confidence in when we're getting the vaccines, how much we're getting, until they can properly plan. Nothing is worse than bringing, literally over 100 people, organizers, that includes nurses, PSWs, docs, anyone that can put a needle in the arm. They get all set, and then all of a sudden, bang, sorry guys, we don't need you today, we've run out of vaccines. And then the work begins to rebook. The challenge is rebooking tens of thousands of appointments. And exactly what happened out, as I mentioned earlier, at Saskatchewan. They had to call back 27,000 people. And we have in excess, they told me this morning actually, Rob, that already by noontime, 75 plus, they've booked 90,000 appointments, and I think 8,600 by phone. So they're doing a spectacular job, and I want to thank all the operators out there. And so as of this morning, before that new number, it was about 250,000 booked. So we're probably in excess right now of over 300,000, and the number's constantly moving. But I hear you. I wish we could be pumping it up to 100, 150,000 a day, and not worry about the supply coming in.
Follow-up?
One thing I don't understand about that is I thought all these vaccinations were by appointment. So can't this be managed from the appointment side rather than from the supply side, if you see what I'm getting at there? If you know what the appointments are, why is there a problem?
Well, that's a good question, but you can't make appointments without knowing your supply. So last week, earlier in the week, we thought we were getting over 300,000 Modernas. Just imagine if we book people to get the Moderna, and all of a sudden, surprise, surprise, it's not 300,000. You're only getting 1/3. You're getting 90,000. That's a lot of burden to be calling over 200,000 people if we booked it up to that point. They want consistency. They want a consistent flow. There's one thing I understand, is supply chain, and you need that in process flow. So process flow has to continue. And in saying all that, Liz here does an incredible job, her CEO, but I want to give a shout out to some of the people. The guru of vaccinations is Gwen. Thank you, Gwen, for all the work you're doing. I hear you're the real champion, so thank you, and it's greatly appreciated. But if I mentioned to Gwen, for example, and sorry to call you out, Gwen, but you're standing there. If I told Gwen, by the way, get ramped up, get your whole team ready for 3,000, and Gwen eats up all the vaccines, and now she's responsible to telling everyone shut the whole system down and bring it back up. It's a logistical nightmare. We just need more vaccines. Bottom line, simple as that.
Last question.
Your final question comes from Len Gillis with Sudbury.com. Please go ahead.
Hi, Len.
Thank you so much, Premier.
How you doing?
Given that Sudbury has been in the gray lockdown zone for more than a week now, the case count is getting higher. We have 3 outbreaks at the hospital at Health Sciences North, and the medical officer of health here in Sudbury said we are indeed in the 3rd wave.
Yeah.
And Thunder Bay is also in rough shape. Premier, would any consideration be given to providing more vaccine product to this part of Northern Ontario and perhaps Thunder Bay as a means of mitigating the situation?
Yeah, great question. And yes, we're the, again, I hate to use these analogies, but where the fire is, that's where we have to put the hoses on, right? If there's outbreaks in certain areas, I think it's important that we reallocate all resources to areas that we see outbreaks. And that's no different than Toronto. Certain parts of Toronto are really in hot spots. So we focus on those areas and along with Peel. But we really want to ramp it up to any region that we see a real big outbreak there. And not just that, we also have to do a lot of testing as well in those areas.
Follow-up?
Premier, your Operation Remote Immunity sure got a lot of praise for being efficient and effective. And, you know, there's many other small towns across the north that are not Indigenous that would benefit from a program like that.
Yeah.
What about rejuvenating Orange and creating some sort of a vaccine flying squad for small towns, you know, that are often 1 or 2 hours away from the larger towns, or even remote mine sites like Iron Gold? You visited Iron Gold.
Right.
You know how remote that is.
Absolutely. You know, that's an excellent question. And by the way, you know, I appreciate you saying our plan, but yeah, it was our plan. But the people that are absolute champions is Orange. They went in there, they made it seamless, and I think that's a pretty good idea. It all depends on the amount of people that are up there, and you know, get up there and try to vaccinate as many people as possible. But what I can assure the people of the far north, we aren't going to forget about you. We're going to make sure we have vaccines for you as soon as possible. But I really like that idea. So we'll have to map it out. I'm sure they've already mapped it out, to be very frank with you.
Thanks, everyone.
Okay, thanks everyone. And I want to again thank all the great people here in Scarborough. You're absolute champions, all the frontline healthcare heroes. Thank you.